Most common cancers amongst Americans, but a visit to the doctor could help with early detection.
Tell us more about Sutter Health's free screenings. We're joined by cardiothoracic surgeon Dr. Stephen Maxwell out of Roseville. Good morning.
Hi, good morning. Thank you.
Thank you very much for hanging out with us. I know you got some free screenings coming up. And how should people pay attention when it comes to lung cancer? Because that's something that sometimes we don't think about.
Absolutely. It's important to remember that lung cancer, while it's the second most common cancer among both men and women, it is the most common cause of cancer death among everyone, accounting for more deaths than prostate, breast, and colorectal cancers combined.
Okay, I had no idea. And what is the screening like?
So the screening is pretty simple. It's a quick, painless, low-dose CT scan of the chest, just an X-ray. We take a detailed picture of the chest and we look at any nodules or abnormal streaks on there to get a sense as to what the likelihood of them representing cancer is. Just because you have something on there doesn't mean it's cancer. In fact, about 98% of the scans we do will not show evidence of cancer, but about 1 to 2% will.
Who are the people that need to be paying close attention? It's like smokers or who?
Absolutely. So high-risk people, either because of smoking history or age. The most updated guidelines, the U.S. Preventative Services Task Force, recommend that anybody that's aged 50 to 80 and has a history of smoking 1 pack per day for 20 years or some equivalent thereof, and is currently smoking or has quit within the last 15 years, can benefit from lung cancer screening.
Okay, so if you find out through the lung screening there is cancer, how would it be treated?
Well, that's one of the great benefits of lung cancer screening is that the majority of cancers that we find with lung cancer screening are of an early stage, stage 1, which means it hasn't spread anywhere. And with a cancer like that, it can be treated either with a low-risk surgery or alternatively radiation therapy, and the prognosis is quite good. Higher stage cancers obviously require more complex treatments, and the prognosis isn't quite so good.
Okay, so you have some free lung screenings coming up through Sutter. I think we're going to show those here. Oh, here's some other facts too. The screenings are November 6th and 13th, and there's various locations like Fairfield, Modesto, Roseville, and Sacramento. These are done at the hospitals, right?
That is correct. It's done in the radiology department at the hospital.
There you go. In Auburn, there's one too on the 13th on Education Street. So,
and this is open to uninsured people as well within the community?
That's correct. So eligible patients who do not have access to healthcare because they lack insurance can get a free lung cancer screening CT if they're eligible through this program.
Any last words that you want to share with us?
Of course. The early detection of any cancer is always better. So definitely talk to your doctor to see if you're eligible for lung cancer screening. It's a covered procedure under any insurance. If you're currently smoking, talk to your doctor about quitting smoking because preventing a cancer is the best still. And if you don't have a doctor, because you don't have insurance, there are mechanisms to get screened through the number provided here.
Oh, very good, very good. Well, thank you so much, Dr. Stephen Maxwell, again, through Sutter Health. And we will post those dates and times and phone numbers, too, on our show info page on gooddaysacramento.com. Thank you so much.
Thank you.
My pleasure. Thank you both, Tina. Thank you, Jim.
But a very important reminder, right?
Yes, yes. Hey, get in the spooky spirit and earn yourself a free hunt.